Hi, my name is Giovanni. I am a co-founder of Asociación Uno, which is an association based in Valencia, and we are focused on project management. Our project focuses mainly on gender equality, gender balanced, and to create a more inclusive and united society. It is a widespread belief that gender medicine represents a kind of women's medicine. In reality, the World Health Organization defines it as the study of the influences of biological differences and socio-economic and cultural differences. Sex and gender are two distinct concepts. The word sex refers to a biological concept which exclusively concerns a person's anatomy, while the social concept of gender indicates the system socially constructed around the same identity. Both aspects have a bearing on health and impact on access to care and assistance that men and women receive differently. Gender medicine studies the social and biological influences that can affect the health pathway and access to care that men and women face throughout their lives. It is in gender medicine that we find the most immediate and equitable key to addressing the diagnostic delay, medical training, and in general the androcentric approach to health that closely concern gender-based diseases. Even before the pandemic worsened things, environmental, social, cultural, and relational factors were among the gender differences that influence health. Stereotypes, prejudice, discrimination, social role, greater exposure to poverty, and the lower average salary received by women are just some of the examples that can contribute to unequal access to health resources. A phenomenon that translates into health risks and inequalities in diagnosis and treatment between men and women. In the case of endometriosis, gender studies identify the taboo of menstruation as one of the possible contributory causes of the diagnosis delay, which is around 7 and 10 years, and thus of the progression of the symptoms. The normalization of female pain can create a stigma that can interfere with early diagnosis. Endometriosis symptoms are characterized by pelvic pain during ovulation, menstruation, or sexual intercourse. This condition affects 10% of women of reproductive age, but according to experts, this figure could be easily underestimated due to the difficulty of diagnosing female pain. It is a pathology with a multifactorial hormone-dependent cause, which tends to have a chronic progressive and relapsing course. We therefore know that pain symptom in a woman can be characteristic, yet despite the fact that endometriosis occurs with no less frequencies than other chronic diseases, it is a condition whose diagnosis is still subject to worrying delays, on average 7 to 9 years after the onset symptoms. However, the diagnostic delay does not affect all symptoms similarly. According to experts, women who complain of pain during their menstrual cycle are up to 13 years late in diagnosis. The reason, however, lies not only in the knowledge of healthcare professionals, but also in a cultural heritage that has implication with respect to the normalization of female pain. It is estimated that an average of 4 years elapse before a patient consults a doctor and a further 4 years for identifying and confirming the diagnosis after an average of 5 specialists have been consulted. Despite constituting more than half of the European population, women are underrepresented in biomedical research, which continues to be based on the tacit assumption that women and men are physiologically similar in everything except their reproductive system, neglecting biological, social, and gender differences that significantly influence health. There is an association between decreased concentration of androgen, those are male hormones, and chronic pain, while estrogen, which are the female hormones, that can increase pain, perception in women. An example of this is pain. In women, the pain is more frequent and more intense, and painkillers are less effective in women than in men, where testosterone seems to have a protective effect on pain. In many cases, preventive and curative strategies are applied to women after being tested exclusively on men, potentially with limited, if not counterproductive, effects. The British journalist Caroline Perez investigated the extent to which diagnosis and treatment pathways are still designed on male bodies. One example concerned the phenomenon of sex-specific responses to vaccines. Women tend to develop more frequent adverse reaction. An insight that in 2013 suggested the idea of producing a male and a female version of the flu vaccine. Limiting the gender approach to an exclusively female perspective would be a mistake. Even though the approach to medicine is more androcentric, male health awareness is less widespread and needs to be better promoted. Experts claim that it is a general male tendency to avoid urological examination and screening and rely on self-management strategies before the first symptoms, favoring diagnostic delays and worsening. Also, fueling these taboos are factors such as access to information. Therefore, a deeper knowledge of gender differences promotes greater protection of health and appropriateness in care.